Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious diseases, hepatology, and gastroenterology. Our topic today about preventing HIV transmission. So, we will discuss the modes of transmission of HIV. Then after that, we will discuss how to prevent these modes of transmission. You can get or transmit HIV only through specific activities. Most preventing HIV transmission, commonly people get or transmit HIV through sexual behaviors and needle or syringe use. Only certain body fluids like blood, semen, pre-seminal fluid, rectal fluids, vaginal fluid, and breast milk from a person who has HIV can transmit HIV. These fluids must come in contact with a mucous membrane or damaged tissue or be directly injected into the bloodstream from a needle or syringe for transmission to occur. Mucous membranes are found inside the rectum, vagina, penis, and mouth. In the United States, HIV is spread mainly by having anal or vaginal sex with someone who has HIV without using condom or taking medicines to prevent or treat HIV. For the HIV negative partner, receptive anal sex is the highest risk sexual behavior, but you can also get HIV from insertive anal sex. Either partner can get HIV through vaginal sex, so it is less risky for getting HIV than receptive anal sex. Sharing needles or syringes, rinse water or other equipment used to prepare drugs for injection with someone who has HIV. HIV can live in a used needle up to 42 days, depending on temperature and other factors. Less commonly, HIV may be spread. So, how is HIV passed from one person to another? From mother to child during pregnancy, birth, or breastfeeding. Also, the risk can be high if a mother is living with HIV and not taking medicine. Recommendations to test all pregnant women for HIV and start HIV treatment immediately have lowered the number of babies who are born with HIV. By being stuck with an HIV contaminated needle or other sharp object, this is risk mainly for healthcare workers. In extremely rare cases, HIV has been transmitted by oral sex. This is very rarely occurred. Putting the mouth on the penis, vagina, or anus. In general, there is little to no risk of getting HIV from oral sex, but transmission of HIV, though extremely rare, is theoretical possible if an HIV positive man ejaculate in his partner's mouth during oral sex. So, receiving blood transfusions, blood products, or organ or tissue transplants that are contaminated with HIV can also transmit HIV. But nowadays it is very, very rarely. This was more common in the early years of HIV, but now the risk is extremely small because of rigorous testing of the United States blood supply and donated organs and tissues. Eating food that has been breathed by an HIV infected person. This may occur in some countries in Africa or in South America. The contamination occurs when infected blood from caregiver's mouth mixes the food while chewing. The only known cases are among infants being bitten by a person with HIV. Each of the very small number of documented cases has involved severe trauma with extensive tissue damage and the presence of blood. There is no risk of transmission if the skin is not broken. Contact between broken skin wounds or mucous membranes and HIV infected blood or blood contaminated body fluids, deep open mouth kissing if both partners have sores or bleeding gums, and the blood from the HIV positive partner gets into the bloodstream of the HIV negative partner. HIV is not spread through saliva. So, we want to reduce the risk of transmission of HIV. Human host, it is not spread by mosquito, ticks, or other insects. So, saliva, tears, or sweat that is not mixed with blood of an HIV positive person. Also, hugging, shaking hands, sharing toilets, sharing dishes, or closed mouth, or social kissing with someone, all these modes of transmission not transmit HIV. Who is HIV positive? Other sexual activities that do not involve the exchange of the body fluids, for example, touching. So, the question is, how well does HIV survive outside the body? Can I get HIV from anal sex? Yes. In fact, anal sex is the riskiest type of sex for getting or transmitting HIV. So, HIV can be found in certain body fluids like blood, semen, rectal fluids. So, all these fluids can transmit HIV. So, as regard also at risk, because HIV can enter the body through opening at the tip of penis or urethra, foreskin if the penis is not circumcised, or small cuts, scratches, or open sores anywhere on the penis. So, the risk reduction very important to prevent these modes of transmission, to prevent ourselves from transmitting HIV. Thank you very much.